Hippocrates, the father of medicine, said all disease begins in the gut. And today we're going to talk about conditions related to poor gut health and when you can actually utilize the GI map test. I recommend the GI map test to every single one of my patients in my practice because disruption of the gastrointestinal microbiome can cause so many varieties of different chronic conditions. Many practitioners will first think of utilizing the GI map test for those patients who present with gastrointestinal symptoms, things like abdominal pain, bloating, constipation, IBD like Crohn's and colitis, IBS. This test is really great at helping to differentiate the difference between a patient who has IBS and IBD by looking at inflammatory markers and calprotectin, fecal occult blood as well. Gastric cancer, gastritis, GERD, reflux, SIBO, ulcerization, vomiting, multiple food sensitivities. These are all patients that it would come to mind to do a GI map test looking at the intestinal health in the lower bowel. But because of the new research linking autoimmune conditions to different gut microbiomes that, given the opportunity, can overgrow, we're also looking at utilizing the GI map test in those with autoimmune conditions, specifically those with rheumatoid arthritis, reactive arthritis, as well as ankylosing spondylitis and Hashimoto's. In the potential autoimmune section, we will go through which particular opportunistic microbacterium that can develop in higher rates are linked to which autoimmune diseases, for instance, Hashimoto's and Yersinia, and rheumatoid arthritis, ankylosing spondylitis with things like Klebsiella and Proteus. So we're going to be going through that as well. We can also look at the GI map test and looking to understand what the gut microbiome is doing in those with allergic disease such as asthma, eczema, and allergies, because we know a significant portion of the immune system in the gut is in the gut, and we can measure the immune functioning by looking at secretory IgA, which we'll go through in the intestinal health markers section of this course. Other conditions to consider are things like anxiety and depression. We know a significant amount of serotonin is made in the gut, your happy hormone. Weight loss resistance. The GI map looks at the Firmicutes-Bacterocytes ratio, which we'll also discuss in detail, but essentially what happens when that ratio starts to increase, you're more likely to absorb more calories from foods, more likely to become obese versus having a lean body composition. And this ties into the insulin resistance piece, which is featured here at the very bottom. If your Firmicutes-Bacterocytes ratio is elevated, not only are you more likely to absorb more calories from the foods you eat, but more likely to have inflammation, more likely to have insulin resistance, which we can see in those with prediabetes, as well as those in conditions like PCOS, which has an underlying insulin resistance piece to it. We are also utilizing the GI map for those who have estrogen dominant symptoms like PMS, fibrocystic breasts, estrogen-related cancers, endometriosis, and low testosterone, and that is because the GI map looks at beta-glucuronidase, which is a marker that can indicate hormone recycling, specifically estrogen, and that will be one that will be discussed in the intestinal health markers section as well. Chronic stress. We know that chronic stress weakens our immune system by lowering secretory IgA. That's measured on the GI map, which we'll discuss in the intestinal health markers as well. But if you're chronically stressed, reducing the immune system in your gut, reducing that mucus layer, you're essentially reducing your first line of defense, as well as lowering your stomach acid. And what that will lead to is a more favorable environment for opportunistic pathogens to grow. So that's something that we can look at as well as those with chronic toxicity and inflammation. Really important to consider the GI map too. So it's not just for gut health. It's not just for these gastrointestinal symptoms. It can be used in every single patient because the intestinal health markers here are so critical and impact so many variety of different organ systems in the body.